Greetings, everyone, and thank you for joining. My name is Terrence Sims, and I'm the President of Strategic Growth and Marketing here at Raintree Systems. This week, we are engaged with our clients and partners for our annual Training and Education Conference. When we considered this topic for our agenda, we thought it would be best to make it publicly available. We have asked Nick Patel, Executive Director at the Alliance for Physical Therapy, Quality, and Innovation, also known as APTQI, to share with all of you this afternoon. APTQI advocates for the profession in the areas of payment reform, quality initiatives, patient outcomes, and innovation. Raintree Systems is a strategic partner and an at-large board member, meaning we have joined in the fight with them, and we too now advocate for you. With that, I would like to introduce you to Nick Patel, Executive Director of the Alliance for Physical Therapy, Quality, and Innovation.
Thank you, Terrence. Appreciate everybody having me on, and hope everyone's having a great conference, learning all the new and exciting things that Raintree has to offer. Unfortunately, this topic I wouldn't characterize necessarily as exciting, because we talk about, unfortunately, a serious issue about looming cuts in the Medicare fee schedule. But this is something that is very important because it does, it affects the entire profession. In fact, it affects multiple professions in the healthcare arena. And unfortunately, not a lot is known really about the background, and not a lot is known on how it will affect us. So my objective during this quick talk is to give you some of that background as providers, as people are intricately tied to the success of your practices, and let you know sort of what's going on, and preferably what you guys can do about it, because everyone has a chance to do something positive to help us avoid this cut. So, just to take a step back, why are we even talking about this? What's going on? Well, in 2019, Medicare made the decision that they are going to provide a much long-awaited increase to the evaluation and management office visit code. So this is a code that a lot of physicians use when they conduct their office visits, and the code had not been updated for quite a while. And in addition to a pretty sizable increase for that code, they also introduced a new code, an add-on code that would be used for particularly complex patients. And that code carried with it a pretty substantial payment as well. So you may be thinking, well, so what? What does that have to do with me? Sounds great. If they need a raise, go ahead and give them a raise. And what's good for them is good for healthcare. Well, the problem, unfortunately, with that is that when they announced that this E&M code was going to have an increase, and they announced that they're going to create this new add-on code, they said that the cost, CMS said the cost for that needs to be completely offset by other cuts to the fee schedule. And what CMS did in their sort of redistribution process is say that the bulk of the offset should be borne by the professions who do not use the E&M codes. We will take it out of their valuations, essentially. So that turned out to affect over 30 different providers. Obviously, therapy, PT, OT, and speech are among them, but we're hardly the only ones. And the reason why we are slated with a large cut is because, quite frankly, we don't bill E&M codes. We don't bill office visits, and we're ineligible to bill this new add-on code as well. So the methodology that CMS basically chose was, let's have the professions who cannot bill the newly valued codes, let's have them pay for the cost for that, and let's let them bear the full cost. So your only sin, if you're a therapist, is that you don't happen to bill E&M codes. That is the full reason why you're getting the brunt of this cut. Now, of course, we push back, and of course, we've been talking to CMS since 2019 on what can we do to avoid this cut, what are ways we can figure out to have better policy. And essentially, CMS's stance has been, numerous times that we've talked to them, that their hands are tied, because there is a congressional statute, meaning there is a law that they must abide by, which states that any changes to the fee schedule have to be done in a neutral manner. So if they increase on one end, they have to decrease on the other. So they're sort of passing the buck, if you would, to put it bluntly, to Congress, saying they're the ones who said that our increases have to be offset. We can't do anything for you. And in fact, this has sort of been borne out because when they initially slated our projected our decrease, the cut was 8%. That's what we thought it was going to be in 2019 when they first proposed it. So despite our efforts to engage with them in some meaningful communication, CMS actually in this year's proposed rule said, oh, by the way, we redid the math, and your cut in therapy land is actually 9% now. So if anything, they actually made it worse. So that kind of gives you a glimpse on how receptive the administration has really been to our feedback that they need to go back and look at how they did their math. So as I said, over 30 different providers, so it's not just therapy, are in line for some pretty substantial cuts. So this is one of our infographics, as you can see, not just therapists, but ERs are taking a 7% cut. Radiologists and interventional radiologists taking a huge cut. Anesthesiologists, radiation oncology, lots of different types of surgeons, pathologists, vascular care professionals. So this is hardly a therapy-only problem. And the nice thing about that is that we have been working and reaching out to all these other different provider associations to say, hey, can we work together here to find a better path forward and tell CMS that this is not something that's really good policy. And of course, in between when they first announced these cuts and now, the country has plunged into a pandemic. And so that has made our stance even more strong that this is not only bad policy during any times, this is particularly bad policy faced with a pandemic that has not seemed to, every time we seem to be turning a quarter, has not seemed to be getting better. We continue to have these flare-ups, and I don't believe anybody at CMS really firmly believes that next year when these cuts are set to go into effect, that the COVID crisis will be gone in a distant memory. I think it's common knowledge now that we will still be dealing with COVID come January. So, going back down just to therapy for a minute, and one of the unique issues for therapy that we've been trying to stress with CMS, it has been that we wanted to know that they took into account at all that therapy services have been used as a piggy bank for CMS for quite a while. We had been cut much more so than a lot of the other professions. And this graphic here kind of illustrates it in a fun kind of way, but how serious these cuts have been and how detrimental they could be to our patients. So many of you guys, if you were therapists, I'm sure remember in 2011 when the MPPR cut was initially proposed, and that was a big cut for us. They deepened that cut in 2013. We had the misvalued code initiative in 2018, which resulted in a couple of our most commonly used codes being reduced. And then, of course, let's not forget, in 2022, we have an assistant, a PTA and OTA assistant cut that's set to go into effect. And now they're sandwiching in this 9% cut in 2021. And so what we're trying to do is make sure people understand we're not complaining about 9% in a vacuum. We're complaining about the cumulative effect of all these cuts to physical therapy at a time when we need someone to look at our long-standing payment and not just saying, well, we need some extra money in 2021, we'll take X amount out of therapy. And so we have been getting some good reception to this, because from our conversations, it seems like a lot of the people at HHS and CMS did not know this. And in fact, this particular infographic was shared with a senior advisor at Health and Human Services just at the end of last year, because when I said, I am not complaining about just one cut in one space of time, but did you know that we took these 3 other huge cuts within the last 9 years? I have another large cut slated for 2022. He did not know that. And when I showed him this graphic, he definitely ate it up and looked at it and said, this is a good point. And so these are the types of things that even administration officials don't know unless we as advocates bring it to their attention. And that's why this is so important. So how will this impact the industry? Obviously, cuts are never good, but if you're really going to advocate for your profession, you need to come with as much data as you can that's unbiased and objective. And really, when it comes to Medicare spend, the most unbiased source of information is Medicare's own utilization data and HHS's own utilization data. So as we've been trying to paint this as terrible policy during any time, but especially during the pandemic, we needed we needed some data that showed what pain that we as providers have already been put through. And again, the best place to get that from is from HHS and CMS from their own data. And that's what we found. And so this is what the pandemic has already, how it's already impacted us. So obviously we can't say what's happened because of a 9% cut. It hasn't gone into effect, but we can quantify what's happened with the pandemic. And so these numbers are straight from CMS. So what they did is they sort of lumped everyone together and made divisions. And the division that we fall into would be the Part B Medicare spend that was non-drug. And that's about as drilled down as we could get it for this year's data. However, it was really interesting. So if you take the level of spend for Medicare and Part B, non-drug, from January 1st, they calculated that the sort of the depth, the absolute worst of the pandemic, as far as a Medicare spend point of view was concerned, happened to be April 8th. And if you guys are out there, working in your clinics and working in the billing offices, I'm sure you guys, you probably would agree that that first week in April was just about as bad as it got. And whether that was your census or being the lowest point, or your receivable, your payments coming in being at the lowest point. But from a Medicare point of view, April 8th was the low point in what they paid out to providers. And that point was 55% lower during the week of April 8th than it was the first week of January. And of course, that was all due to the pandemic. Now, the nice thing is a lot of our clinics and a lot of our professionals have seen a rebound in census, have seen, as things have opened again, hospitals have started performing surgeries and elective procedures again, and that has obviously been a positive impact upon us. However, cumulatively, we have not actually recovered fully yet. So cumulatively, we are still down 19% as of July 1st from January 1st. And those are visits, those are dollars, those are your receivables that are not coming back. They're gone. And we would have to, to end up 2020 even, we would have to probably be 0.5% higher every week than where we are now, just to make it to even, which is probably not going to happen because, like I said, the pandemic isn't going away in the next couple of weeks. So even though there was a rebound, even though some of the hospitals have turned open again and elective procedures are going on, you cannot forget that we have already absorbed, not to mention all the cuts from 2011 and 2013, we have already absorbed a cumulative 19% decrease for the first half of this year. And that's real. That has resulted in furloughs, that has resulted in some clinic closures, which in turn affects access. And those are real damages that have occurred in our industries. So our stance has been, this is your data, CMS administration. This is what you are telling us you paid out. You've paid out way less this year than last year. So we are in a pandemic. We have been damaged, and we are these cuts. The effect of these cuts will just be magnified if you continue to go through with your plan in 2021. So in essence, CMS, as crude as it sounds, they saved money this year. They have not spent what they usually spent this year, and they're not going to. We've only got a few months left in the year. So part of our argument has been, we have taken this damage, we have taken this cut, you have not spent what you normally spend to, on the benefit, on the benefits. So why are you trying to take another 9% out of us in just a few months? So that's sort of where we're at. And if you guys are anything like any of the therapists I know, you always want to know, what can I do? Like, that sounds bad, Nick. I understand now. I understand why it's happening, but what could I do? I'm a therapist. I'm a practice owner. I'm a biller for my company that I want to see succeed. There's something tangible, things that I can do. And there are a lot of things that you can do, actually. And I hope that after I finish this next couple of slides, you feel empowered to take a few easy steps, but then maybe even empowered to take some not so easy steps. So first, let's start off with the easy things. If you're with someone who just wants to do send some quick emails, you can do that. And APTQI can make it easy for you. If you go to our website, aptqi.com, we have a take action page. Click on that. And what you can do is actually just fill in your name, your address. It'll automatically find out who your members of Congress are, and it'll send off a note asking them to make stopping the cuts a priority. Okay. It's as simple as that. It would take you 30 seconds. You don't have to know who your elected representatives are. You'll find out who they are for you based on your address. Okay. And you won't be alone. So, we also have done some polling. So APTQI helped commission some polling. And what we realized is that unfortunately, we polled 1,000 registered voters who are over the age of 65. So these are Medicare age registered voters. And as you might imagine, about 3/4 of them, a little over 70%, had no idea these cuts were going to go into effect. No idea whatsoever. And these are your patients that you see every day. So you know now as a provider, but does your patient know? And I would encourage you strongly, have your patient go to that website as well and introduce them, say, hey, would you like to fill this out? I think that's incredibly strong. And what we found is once the patient or once the beneficiary understands what's happening, what's on the deck, I'll share with you what the polling showed. So 70+% never even knew about the cuts. However, in the polling, we explained very briefly what the cuts meant and what happened in January. After reading that, 93% of those seniors who read about what was going to happen said that they believed access to a physical therapy center was important to them. 66% of the seniors who, after they found out what was going to happen, said that they would be more likely to vote for candidates who supported stopping these cuts than candidates that didn't. Okay, so all you need to do is educate them a little bit, and you're probably, just by the odds, you're gonna get an advocate for your profession and for your services. Okay, and again, the APTQ website, the Take Action page, is open to anybody. We have not put it behind a firewall. You don't have to be a member. You don't have to be a Raintree client. Anyone can use it. Any patient can use it. It is free for everyone. Okay. The second thing, if you want to do something maybe a little bit harder, but maybe lands a little more impact, I would strongly recommend you actually just pick up the phone and call your member of Congress. Okay. And actually say, hey, this is my name. This is where I live. I'm a constituent. This is how many patients I see per day in your district. This is how the pandemic has already affected me. And this is what the effects of this cut will be on access for my patients. You answer those three things and you can hang up the phone. And I will tell you that members of Congress are very used to getting a lot of letters to the email. And sure, it's nice because email can deliver thousands of correspondence. So just for an example, APTQI's last campaign to Congress sent 20,000 emails in about 2 weeks. So we can drum up great responses. But offices know this, and they know that email is easy to do, and they know that it's also a little bit harder for that constituent to actually pick up the phone and call. So when they receive a phone call, it kind of gets weighted a little bit higher. So just so you know, that's why that is encouraged. The next thing that you could do is, utilize your social media. So if you have a social media channel, it's pretty healthy. You have a lot of followers. We're having a virtual advocacy day at APTQI on October 28th. Make your appeal to Congress on that day. You can follow the Alliance. Our Twitter handle is on the screen. And if writing an email is one level and calling is another level, making a short video takes it even higher, because everyone likes to watch a video, especially if it's only 5 to 10 seconds. So if you could post or tweet or tag your member of Congress to say in a very quick video, I'm your constituent and I need Congress to act because this cut will, and then fill in the blank. What will it do to your business? What will it do to your patients? What will it do for access for your patients? That would be incredibly powerful. The more we can get done on that October 28th day, the better. Obviously, we're in the middle of an election, And as I said before, we have some great polling data that shows that once people understand the issue, it can potentially affect their vote. And the hashtag that we're using along with a lot of other providers is hashtag fight the cut. So the other things that we're doing as APTQI is we're also realizing that even if we get something done, it might just be a short-term solution. And we've got to do a long-term, we got to find a long-term solution to this, because I don't want to fight every December. Terrence and I don't want to go to Congress every December and say, hey, there's the cuts happening again. Can you please do something about it? Many of you guys may have therapy cap, traumatic trauma, because that's what we had to do every year. And Congress hates it, we hate it. So we want to work on long-term goals. We're looking at data that shows that maybe when you cut the lowest cost providers like therapy and other clients, what you're doing is just shoving them into higher cost of settings. So why would you want to do that? If you decrease options that are low cost for a patient, they're still going to get hurt. They're still going to get sick. They're still going to need care. And if the only places that are left are higher cost of care services, are you really maintaining budget neutrality for the Medicare benefit plan? That's what we like to show. So what's going to happen in the future? The final rule will probably come out end of November, early December. They're going to be late with it this year by all indications. And they still have the ability to cut, to reduce our cut if they want to. CMS still has the ability to. They just not really shown us any indication they would. And that's why we're thinking that the only real path here is Congress. But the more pressure we can have put on by Congress, the better. So that's where we're at. That's what we're trying to do. There is some light at the end of the tunnel. We recently just had a congressional letter sent to leadership in the House that was signed by 229 House members asking Speaker Pelosi and Leader McCarthy to make sure that future legislation includes a fix the fee schedule. So that just happened. So things are happening as we speak that are positive. But I'm happy to take any questions if anyone has them about the cut or what we're doing or what you guys can do on your from your end as advocates.
I have a couple of questions, Nick, from a couple of our users. The first is it starts and then it has a follow-up question. So I'm going to ask the first part first. From Kelly, from Dr. Kelly Barr, who's one of our providers at Raintree. So her question is, I would like to confirm that you are the Dr. Patel that taught the management class in the PT doctorate program at UTMB in 2011-ish.
Yes, Kelly, I am. I definitely recognize the name. And I definitely remember you. Yes, you were in my class. I don't want to say how many years ago, but yes, that is me. And I'm glad you're doing well. I'm glad to see you're a Raintree client. I like that.
So her follow-up question to that is more relevant to the current topic. So does this mean that the TRICARE Champus maximum allowable will then be going down 9% for therapy services since it is based on CMS rates?
Yeah, that's why you're one of my best students, Kelly. Yes, you're absolutely right. So one of the reasons this will impact us so hard is because there's a lot of insurances that are pegged to Medicare. So Kelly's in Texas. So you're right. Workers' comp is pegged to Medicare in Texas, right? The subscriber. So on day one, you're going to get that cut in workers' comp. The military insurances, TRICARE, VA, those will be cut as well. If you have a private payer that is pegging their reimbursement to Medicare, they will pass that cut along to you as well. So yes, you are correct. Most of the governmental payers like the military, TRICARE and VA contracts, our fee schedules will be tied to Medicare. So when you cut the Medicare's conversion factor for therapy, you will see a cut on those services as well, probably.
Right. And I had a couple of other additional people asking the same question about affected payers across the board. Is it likely that, or certain that Medicaid will follow suit with these Medicare cuts?
Yeah, Medicaid's slightly different because it's more state by state, but so I can't say certain there as well as I could with some of the others, but likely is, yeah. Likely is probably the best answer, yeah.
And then Scott Fisher asks, these cuts will also hit pediatric therapy, correct?
As long as you're paid off the Medicare physician fee schedule, then this cut would apply to you. So it depends on what fee schedule you're on.
Yeah, or any other payers that choose to follow suit. So there definitely is the potential.
Yeah, correct. So the entire cut is based on the Medicare physician fee schedule, which is under the Part B spend.
Question from Natasha that says, do you know if New York workers' comp will be affected by this?
Good question, Natasha. I don't know if New York state pegs their work comp to
I don't know.
to Medicare. I don't know off the top of my head. Unfortunately, some
Right
states
off.
do, but yeah.
Yeah, I don't think New York does, but it would be worthwhile to just confirm that they don't go off the Medicare fee schedule as far as how they, for work comp. I don't think New York does, but that's an excellent question. I'll take that as a takeaway.
Yeah. Additional question. Do you think the assistant pay changes will change the fee schedule over time for the licensed provider full therapist fees if we hold on long enough?
If I don't answer your question, shoot Catherine another note. But the assistant cut is still slated to go through in 2022. Obviously, we were spending a lot of time on that cut before this cut came on, and it had to absorb some of the bandwidth. However, we do feel like most of the indications were that besides Medicare, that there were other plans that were going to institute the cut as well for assistance as soon as Medicare put it in. You would, and you'll know that if you see your payers asking you to add a modifier to your assistant treatments on your claim. If you see them asking you that, they're preparing probably to cut your assistant.
Which we've seen in several states. I do have an interesting counterpoint because that is it is an interesting point though. If Medicare, and this is just truly conversational now, if Medicare or CMS truly are budget neutral, should they not offset the reduction in fees for the provider, the fee schedule that they are saving by the assistant? Should they not apply that to the full fee schedule for when the provider is providing the care? So what are they doing with that difference? Should they not be reapplying that to therapy and increasing the fee schedule for when the service is provided by a qualified therapist or a licensed PT, as opposed to just saying, hey, we now get the extra money?
Yeah, unfortunately the savings for the savings for the assistant cut have already been allocated elsewhere.
Coming back to therapy, obviously, but
yeah, and so we won't be able to get that bump. And then the other part of it is for a long time, therapist assistants were one of the few assistants that did not have a payment differential, because a lot of the other assistants do in healthcare. Right. And their supervising practitioner did not get increases when their assistants were bumped. So there's not a lot of precedent for it either. Yeah.
They use their argument of budget neutrality when it feels when
it's convenient.
When it's convenient, exactly. It's like you're giving this cut here. Okay, so what are you doing with all this surplus? Can you feed it back into the fee schedule and offset it on the other side?
Well, and that's where we're going with the 19%. This year, cumulatively, Medicare has spent out less money in the benefit plan than they normally do. They will end this year much less. And so we're trying to get some of that along that line of argument you just said. We know you're spending less money this year.
Right. So what are you going to do with that? Yeah.
So what are you going to do with it? Correct. And we're trying to get some of that correct.
I think we have another couple of questions from Kelly.
Kelly said, is cost reporting for assistants and therapists separate?
Not yet, but as the modifiers are used,
but it will be.
Yeah.
Hey, Nick, a question for me. Given all of this movement that we're dealing with and facing that's more immediate, between the 9% cut as well as the impact that we're likely to see on mid-levels or assistants in the following year, where is the landscape right now with regard to virtual care, telemedicine, telehealth, and how that in and of itself could also be impactful from a reimbursement policy perspective? Are there any indications out of Washington among legislators as to how they may land on things of that nature, considering the things already facing the profession?
Yeah, that's a great point, Terrence. And one of the things that did happen in that April-May timeframe when we were dealing with the depths of the pandemic was we found that CMS and the government were much more amenable to making quick changes on the telehealth provider eligibility than they have in the past. And we believe a lot of the feedback from patients and providers that they made telehealth work, and it did fulfill a need, and it is in some cases perfectly okay and able to get the patient what they need has been received by CMS. They have heard the feedback, And I believe that a lot of the telehealth emergency waivers that center around telehealth that were furnished in this spring, I think the landscape is pointing to some of those being made permanent. There is, and that's mostly based on the feedback they've had from groups on that they liked it, that it helped when they were stuck at home and everything had to shut down. So I believe that that's a disruption that has been hastened, and we have probably jumped us ahead about 5 years on the glide path toward adopting more virtual / telehealth mediums for treatment.
I do have one statement from Owen that says, thanks for your efforts, Nick.
Appreciate it, Owen.
They are ongoing, Owen. They are ongoing. They're never cease.
Yeah, we won't stop. Yeah, we won't stop. We won't stop.
Are there any other questions for Nick today? Anyone else have any other inquiries or concerns or questions?
I do not have any additional questions posted currently.
Right. Well, I appreciate the time, guys. I hope everyone has a great remainder of the conference. And Terrence knows how to get a hold of me. If anyone has questions later on that needs follow-up, I'd be happy to.
Nick, on behalf of Raintree and the profession, I'd like to thank you and the APTQI for all that you're doing in advocacy to ensure that we can continue to do the things that we are passionate about and providing movement and mobility to our population across the country. Thanks, and I'm sure we'll be having you back.
Appreciate it, guys. Thanks so much.
Thank you.
Bye.